Today I will be demonstrating how to take a manual blood pressure reading. Taking a manual blood pressure reading is very important to your health because it can indicate whether you have high blood pressure, also known as hypertension, which can cause heart disease or eventually strokes in some people. It's crucial to your health and to let your doctor know what your blood pressure readings are on a regular basis, so it's a very good skill to have if you can take it manually. I've been taking manual blood pressures for about 6 years now. I started in high school and I have continued throughout my college career as well as during my last year of nursing school. We're going to go through the 3 steps of how to obtain a manual blood pressure. The first is to gather your equipment. After that, what environment you should take the blood pressure in, and finally the actual steps of taking the manual blood pressure. It's a good idea to be able to take your blood pressure because you can help out your friends and your family by monitoring with them their blood pressure. So first we're going to gather our equipment. We have a table here set up, a chair, that way someone can be comfortable and have their arm resting on the table. After that we need the stethoscope and a manual blood pressure cuff. Second is that environment that you take the blood pressure in should be well lit, that way you can see the monitor of the blood pressure and read it correctly. Secondly, you need somewhere that is quiet and free of noise. That way you can hear the heart sounds through the stethoscope clearly. And lastly, we're going to actually obtain the blood pressure. So what you're looking for when you obtain a manual blood pressure are 2 numbers, and they're referred to as your systolic and your diastolic numbers. Your systolic is the first number that you hear through the stethoscope when you're monitoring for blood pressure. And so it'll be usually over 100 somewhere, and that's the first noise that you hear. The second noise is the last one that you hear, and that's your diastolic reading. So may I have a volunteer from the audience come up and I will take your blood pressure. Right. On the blood pressure cuff is a marking, and it'll say above your artery with an indicator down it. You want to put that directly above the brachial artery, which is at your elbow bend. So we're going to line that up here. Make sure that the cuff is snug, but not too tight. And then place the monitor at an angle that you can see it clearly. Okay. After that, you want to place your stethoscope in. And you want to put the diaphragm of the stethoscope directly on the brachial artery. Now we're going to pump it up to about 180 milligrams of mercury, and we're going to slowly release that and listen for the first number, which is the systolic, and then the last number, which is the last heartbeat. Okay. And slowly releasing. You remove the blood pressure from your client, tell them to relax, and then record the number with today's date and the time. So you want to have an accurate recording of the client's blood pressure. In conclusion, you can take someone's blood pressure following 3 simple steps: gathering the proper equipment that is needed, an appropriate environment, and following the procedures for obtaining the blood pressure. Now that I have demonstrated how to manually take a blood pressure, you can hopefully go back to your friends and family and be able to practice and help monitor their heart health. Does anyone want to give it a try?